So, we have covered more of the bones which is required for us to learn. We are left with this particular bone. We just like go through the little bit of this particular bone, sphenoid bone, just very basic parts. But before we get into it, we have to understand where these particular bones are there and how this cranium is divided into. So, we know this particular cavity of the cranium divided into 3 segments: anterior, middle and posterior part. This posterior part or posterior cranial fossa, middle cranial fossa, anterior cranial fossa. Now, this particular fossa have got a domain bone which is present more or less in the 3 parts is this central bone. This is what we call them as the sphenoid bone. Now, this particular sphenoid bone has a central part which is hexagonal kind of thing. We call them as body of the sphenoid. And in the front side, it has a wing-like structure which is small wing, and in the back side, it has a big wing. So, we call them as wings of the sphenoid, anterior wing which is smaller and little bit antero-inferior which is a larger wing, we call them as greater wing of sphenoid. This is from the upper side you are seeing. If you flip it, you find another part of the sphenoid bone from the underside. If you are just like seeing this base of the skull upside down, we see this particular the sphenoid bone from the inner side also have projections which is projecting to the base of the skull region. So, if you study this base of the skull, this is the base of the skull, this is the sphenoid bone, and this particular sphenoid bone have got projections in this particular region which is attaching to this particular midline bone like palate and everything. We call them as pterygoid plates. To this particular pterygoid plates or pterygoid process, we have the muscle attached to here, we call them as pterygoid muscles. They are muscles of mastication. There are 2 such muscles are there. Now, these particular pterygoid plates can be seen from here. If you remove this zygomatic process from the sides, and then you can see these particular flaps. So, these particular flaps we call them as pterygoid process. There are 2 such flaps are there, one is medial and one is lateral. We call them as lateral plate of pterygoid process and medial plates of pterygoid process. This lateral plate of the pterygoid process into which the pterygoid muscles are attached to it. The medial one gives attached to the muscles on the pharynx. So, these are the parts of this particular sphenoid bone that we are referring. Again, to magnify this, this is the pterygoid plate that you are seeing from the lateral side. If you cut this from inside, we see a skinny part of this pterygoid plate, we call them as medial pterygoid plate. So, together they call them as pterygoid process. And if you are seeing this from inner side, this is the pterygoid plate that we are referring to this particular side. This is what we call them as lateral pterygoid and medial pterygoid plates. Lateral pterygoid plate, medial pterygoid plate, they are kind of plates into which this particular sphenoid bone inferiorly projected into it. And this central part, this is a body which is uniting with this particular part, we call them as this occipital bone, making a joint, we call them as base occipital with the base of the sphenoid, we call them as basisphenoid or basi-occiput. Together they are making a primary cartilaginous joint. Initially it was having a cartilage, later on replaced by this particular cartilage into bone, making this particular primary cartilaginous joint. So, this is we have learned so far. These are the pterygoid processes that we are referring here. We will see these particular plates. Again, this is a live pictures. So, this is the central part, this is the plates that we are seeing, and we will be seeing this particular individual bones as well. Within this particular sphenoid bone wing, we have this particular foramens that are present. So, ideally this particular bone, we just have to know about the parts of it, which is that the individual parts of this particular bone, and again the foramens which are seated in it. In the examination, if you are given to this particular bone, they will ask this particular general questions which is including the parts which is related to this general parts of the bone, and then they will eventually go to the foramens which are related to it, which we are familiar with: foramen rotundum, radicerum, spinosum, and SOF, optic canal. All these foramens are linked to it, this particular bone. So, we have a cut sections of this particular specimen of the sphenoid of the skull like this, sagittal sections. It is showing like this the cavity of the sphenoid bone that we are seeing here. This is the cavity of the sphenoid, we call them as sphenoidal air sinus, this central part which is lying deep to the body, and the sphenoidal sinus, you know that this is the expansion of paranasal sinus, which is likewise the maxillary sinus, ethmoidal air sinus, frontal sinus, this is there. And individually, if you remove this particular sphenoid bone, it looks like this. So, this is a sphenoid bone cut section which is having this particular central part which I am holding here, the body part. This is the posterior part of the body. and what you are facing towards you is the anterior part of the body, into which we had the ethmoidal air cells, which is a separate piece of bone anchored to it, cannot be separated properly in this particular specimen. And these are, which I am holding this, which is called them as the wings of the sphenoid. These are the wings, which looks like a wasp, that is why we call them as sphenoid bone, looks like a bat or wasp. So, these particular sphenoid wings, there are two of them. These are the bigger wing, we call them as greater wing of the sphenoid, and anterior to it, this one, tiny one, these two, we call them as lesser wing of the sphenoid. So, if you are seeing this particular part, this is the lesser wing of the sphenoid. So, this is the lesser wing of the sphenoid, holding this particular cavity to it, we call them as optic canal, through which optic nerve with the meningeal covering and the content of it, including the subarachnoid sinus or subarachnoid space, is running through this part. And then this part which you are seeing here is that body of the sphenoid. So, this particular body is having like square or kind of room shaped structures, that it has a roof, it has a floor, it has a lateral walls, anterior wall and posterior wall. So, 6 walls are there, just like a room it has. So, this is the anterior wall which you are seeing here facing towards me, the posterior wall. This are the lateral walls, right and left, and roof is this one which you are seeing here. This is the facing the top, this is the roof, and the one which is facing down, it will be the floor. This is the parts of this particular body it would be. And this greater thing, we call them as greater wing of the sphenoid. We can see that how expanded it is, having this separated from this part. This is a greater wing of sphenoid running over anterior to posterior, and this tiny one separated from it, we have this lesser wing. So, we have this particular bone having 4 parts. We call them as body, the central part. Then we have these wings, greater wing and lesser wing. Then after this particular greater wing and the lesser wing, we have the downward parts, into which this particular bone is standing. You see this particular bone, if you are placing it, it is standing on this particular part. We call them as plates. This particular plates, we call them as pterygoid processes. There are 2 such processes are there. This one is the medial one, this one is the lateral. This one is the medial one, is kind of like a in between this one, medial pterygoid plate, thin one, and this one is lateral pterygoid plate, so lateral pterygoid process. So, thinner one and this one is together, we form this particular pterygoid plate or pterygoid process. Out of this medial one, which is a skinny one, the lateral one is having that little bit flappy one, but both of them are thin plate of bones. Now, this lateral plate of this ethmoid bone gives attachment to the muscles of mastication, both of them, medial pterygoid, lateral pterygoid. They attach to the medial side of it, that means the inner side and the outer side. By that, the pterygoid names are given, medial pterygoid muscle, lateral pterygoid muscle. The medial attachment on the lateral plate, it gives this medial pterygoid, which is stronger or thicker. The lateral attachment to the lateral pterygoid plate, we call them as lateral pterygoid, and both of them are muscle of mastication. They help us in chewing, making the movements supplied by the trigeminal nerve, V3 mandibular divisions. So, this is the muscle attachment which is related to it, we have to know. Alright. So, this pterygoid plate or pterygoid process, 2 of them, lateral and medial, by the muscles, you remember that, and remember that both of the muscles are which are having the pterygoid name attached on the lateral sides. Medial one is giving attachment to the muscles of the pharynx, which is related to this oropharynx, laryngopharynx, those pharynx inside one, right. So, 2 plates are there, medial and lateral one. Lateral one is the one which has been given most of the time in examination, because the examiner wants to know about the pterygoid muscles, the name of the pterygoid muscles, the functions of the pterygoid muscles and the nerve supply to it. Medial pterygoid and lateral pterygoid, both of them are attached to which plate? Lateral one. Medial side of the lateral one, medial pterygoid. Lateral side of the lateral pterygoid, lateral pterygoid. And muscle of mastication innervated by trigeminal nerve, V3 3rd division mandibular branch. What they do? They do in help in mastications and various types of movement like sidewise movements, protraction, retraction, etc., etc. Along with that, they stabilize this mandibular joint as well. So, this muscle attached to this particular bone, that what we have to know out here. Apart from that, the clinical importance of this is that this lesser wing holds a cavity, that particular cavity present in here, we call them as optic canal. Optic canal transmits what? The exam questions are there, we will know that optic canal well. Then coming to this particular superior orbital fissure, which is placed between this, you can see that superior orbital fissure, this one, between this particular lesser wing and the greater wing partly, we see that SOF, what structure passes through it, we already did that drill, right. So, we have to mention. Then we have this particular foramen, round foramen, foramen rotundum, foramen ovale, and this part we call them as spine of the sphenoid. Spine of the sphenoid is related to a foramen, we call them as foramen spinosum or spinosum, right. So, these are the things that we have to know, and backward to it we have the foramen lacerum, which is present to this side, which is covered by this particular petrous part of the temporal bone. So, under to it foramen lacerum, under to this particular region, which is not transmitting any important structure, covered by a cartilage plate, have some veins running through it, we call them as emissary veins. So, this is about this greater wing, the foramens. We know that we have to remember what structure passes through each of the foramen, neural structure, non-neural structure. Tons of time we made this particular thing clear about the neural structure and non-neural structure. You have to memorize and link it up. Cannot memorize that thing in a day, do the drill every day. So, eventually in the day of examination you should be able to say about this particular content. The lesser wing holds this particular optic canal transmitting here, and in between this particular lesser wing and the greater wing and this body of the sphenoid, we have the SOF, superior orbital fissure. So, whenever you are given to this particular bone, whenever you see that, the basic thing you are going to see is the parts of it. The parts, number one is central part, body, then we have the wings, two wings or pair of two wings, anteriorly small wing, lesser wing, posteriorly bigger wing, greater wing, and then under to it we have the plates. The plates we call them as by the muscles which are attached to it, we call them as pterygoid plates. There are two such pterygoids are there, medial and lateral one. Lateral one is the one which is giving attachment to the pterygoid muscles. There are two pterygoid muscles are there, medial and lateral. How they are named? They are attached on the medial side of it and lateral side of that same pterygoid or lateral plate. Alright, medial pterygoid plate is skinny one, it gives material attachment to the soft tissue muscles of this pharynx muscles. Alright, if you do not this medial pterygoid, let go. They have some kind of other foramens related to this particular pterygoid plate, so vomerovaginal canal, etc., etc. You just like skip those parts, do not have to remember those parts. Only thing which is related to the base of the skull and this particular lesser wing and the greater wing and this particular SOF, that what you have to remember primarily. Later on, if you have time, remember about this particular like a canals or the tracts which is related to the inferior surface of the body of the sphenoid. Now, coming to this particular part which is related to the body. This particular body you are seeing here, superior part, we call this superior part has a cavity to it. This particular cavity we call them as like a cavity of the Sella Turcica or lying in the body of the cavity, body of the sphenoid over here. So, here is the sitting point where we see the pituitary gland is placed inside this particular cavity. So, this cavity you are seeing here where I am placing this particular marker here, this is the cavity of the pituitary gland where it is placed in here. We call them as cavity of the Sella Turcica. It has an anterior part which has a posterior part. So, anterior to this particular Sella Turcica we have a ridge, you see that this particular ridge, on top of this particular ridge little bit posterior to it we have this optic nerve coming from right side and left side. So, they are crossing each other. So, optic nerve crisscross, they come and close or just like cross each other. We call them as optic chiasm, we call them as optic chiasm or optic chiasma. So, the fibers of the optic nerve right side and left side, they cross the path of each other and they exchange the fibers at that point, right. So, that particular region which is the crossover coming from this optic canal comes over here and crisscross. So, this particular point where you see this particular ridge, this is the ridge, little bit posterior to that we have the optic chiasm which is lying on top of the pituitary gland. So, pituitary gland is sitting in this particular cavity of the Sella Turcica. On top of that we have this particular optic chiasm which is related to the body of the sphenoid. Now, what happens if you cut this body sagittally? You go to the cavity of the body. What cavity is present within this particular sphenoid bone, which is known as sphenoidal ear sinus. This is the sphenoid ear sinus which is cut through. Now, on top of this sphenoidal ear sinus, what you see that the sphenoidal ear sinus has a bottom cavity or bottom part which is related to the nasal part and above which is related to the Sella Turcica. So, through here if you pierce it, you see this particular cavity of the Sella Turcica. So, this particular thing which is important for surgery to do if you have to in case of the surgery related to the pituitary gland. Say for example, a pituitary gland tumor is there. How deep this pituitary gland is there? Sitting in deep centrally placed over here. So, you cannot do a surgery cutting this particular cranium and cutting all the way through the brains and get into through the surgery if it is required to. So, there is no root there. or else you destroy the half of the brain to reach to this particular pituitary. So, how come you reach to this pituitary gland? The easiest way to reach to the pituitary gland is cutting through this particular bones. So, this particular bones reaching to this particular sphenoid, we call them as transsphenoidal surgery. If you have a sagittal section of this particular cut section, that will be the easy one to see. So, we call them as transsphenoidal surgery of the sphenoid. Alright, this things serve, or alright, we do not have a picture like this what this particular specimen is showing us, but anyways. So, thing is that we go through this nasal cavity. You see the nasal cavity, roof of the nasal cavity. Over here we reach to this particular superiormost part of the roof and go little posterior to it. So, this particular posterior to the nasal cavity, we have this particular choana here. So, on top of the choana or posterior nasal opening, you hit this particular sphenoidal ear sinus. So, you break this sphenoidal ear sinus, go to the sphenoidal ear sinus cavity. So, this floor of the sphenoidal sinus is there, then you are in the sphenoidal sinus where you are projecting the laser here. Then you break this roof of the sphenoidal sinus. Once you break the roof of the sphenoidal sinus, you are basically reaching to this particular point where this pituitary gland is placed. Where the pituitary gland is placed? In this point we call them as Sella Turcica. Where is the Sella Turcica? This is the Sella Turcica where the pituitary gland is there. So, from the bottom side you are getting into it and breaking through the sphenoid, through the nasal cavity you are reaching. That kind of surgery, reaching through this particular sinus, through the sphenoidal ear sinus, reaching to that particular pituitary to do the sinus, we call them as transsphenoidal pituitary gland or hypophyseal surgeries. That is what this particular sphenoid gland is really important surgically if you have to do. Other than this, this sphenoidal ear sinus opens into some kind of nasal cavity. We will learn about this particular in the paranasal sinuses. So, I do not want to complicate these particular parts at this particular point because we have this particular osteology class. We will link this particular thing up what I have said about the sphenoidal ear sinus in the, if I given with this particular class on the paranasal sinus, we will talk about it, or else whoever taking class they will talk about the sphenoidal surgery or transsphenoidal surgery, or else check on your own about the transsphenoidal pituitary surgery and approach way. It is very easy to find that particular detail of it to reach this particular Sella Turcica. So, for cutting through this brain like this, removing this brain, then you can do the surgery, it is not possible, right. Now, coming to this particular sphenoid bone, the posterior end of this particular lesser wing and this particular point which is projected like this. So, we call them as clinoid process. This bulbous end looks like a hook, they call them as clinoid process. To this particular hooks, anterior clinoid process and posterior clinoid process over here, projected part, we have this particular cavity placed in here. So, basically they are making a curtain for something. So, this particular point we call them as clinoid process gives attachment for the meninges. We will talk this particular meninges in like today or tomorrow's lectures about the folds of the meninges that we are going to bring in. So, this particular meninges, a part of meninges is attaching to this particular point, we call them as clinoid process, which is related to this particular sphenoid bone lesser wing and this particular body posterior end of the body, which is projected in the backwards and projected in the frontwards. They are looking like a hooks for holding some nets. So, that is like you have nailed over here in this wall and nails over here, and in between you just like hanging some rope or hanging a mosquito net like that. So, that kind of hooks helps in hanging some kind of a layer of mesentery, a layer of meninges, we call them as a fold of meninges, we are going to talk about it. So, that particular hooks we call them as clinoid process, anterior and posterior. So, this is about this particular sphenoid bone in short. There is a lot of detail about this sphenoid bone is there, but it is not required actually for us for undergrad level, but basic utility of this particular sphenoid bone is that you have to know the basic parts, and this particular basic part body is very important for us for doing surgery or clinical problems. Why? Because through this particular body we have a sinus. What sinus we have? Sphenoidal ear sinus. We call them as sphenoidal sinus. What do the sphenoid sinus is of? It is of an expansion for the nasal cavity. That means it is communicated to the nasal cavity. So, that is this particular cavity of the sphenoid bone is present on the sphenoid bone itself. Now, this particular cavity of the sphenoid is lined by the mucus, etc., etc. Now, these things is that this sphenoid bone, upper part of the sphenoid bone body holds a space there. We call them as Sella Turcica. Sella Turcica, into which we have a pituitary or master gland there. So, if you have any problem related to this particular pituitary gland, you have to do a surgery if it is required. So, then we have to reach to this particular gland, not cutting through the brain, we have to reach cutting through the bones. What bones we will be cutting or breaking in here? That sphenoidal ear sinus. And breaking them, we reaching that, we call this particular track as a transsphenoidal surgery of pituitary gland. This is a revolution of surgery is concerned in the head neck region. Because of this particular easy process approach, this surgery could be done. I don't know like whether they will be able to save the lives or not, because it's a very complicated place. Most of the times they do not do a surgery if they find that there is a viability or morbidity is too high. Just like we have a famous Indian star who died of a tumor of this particular pituitary, Irfan Khan. He died of these tumors only here, but he refused, or he has not been advised to do the surgery because that approach way through the sphenoid was not that yielding, only given with this chemotherapy and radiotherapies in that particular. If that particular surgery need to be done, that run through sphenoidal sinuses, transsphenoidal surgery. And apart from anatomical point of view, the sphenoid over here is related to this particular point. We call them as the openings of it. That opening which is related to the lesser wing, opening related to the between lesser wing and the greater wing, and within this particular greater wing substances, all that we have to remember, identify in this particular specimen given to it. So, whenever you are given to this particular bone chances over here, check this particular bone and as well as identify the pterygoid plates which is hanging from the inferior part. So, holding this particular bone is easy, is identify the anterior and posterior. Easy to identify, the lesser wing is anterior, greater wing is posterior, the spines is on the posterior side, the plates is underside, this is the downside inferior part. This is the Sella Turcica, you have to identify the anterior end of the Sella Turcica, we find this particular the optic canal which is present to it. So, this is the anterior side, this is the posterior side, centrally placed, hold this particular bone in anatomically like this, and keep these things as horizontal as possible whenever you are holding this, keeping this particular Sella Turcica horizontal. And then we have this particular like plates of the sphenoid bone, we call them as pterygoid process or pterygoid plates, two of them paired, right side, left side, medial and lateral. Lateral one is attached to the pterygoid muscles and medial one gives attachment to the muscles of the like the pharynx. If you forget, don't worry about this particular thing. Other thing which is related to this particular sphenoid bone bodies, this side of this particular thing, we see that this particular body and this particular body joins with this particular greater wing. In between the junctions of the body and the wing, we have a narrow cleft. This particular narrow cleft, we see that we call them as carotid sulcus or carotid place. So, this particular carotid arteries, internal carotid artery gets through this particular carotid canal and it sits in here. So, this particular area we call them as carotid sinus, they are present by the sides of the body of the wings of the sphenoid. And then to this particular region, we have this particular venous channel present. We call this venous channel by the sides of this region, we call them as cavernous sinus. So, cavernous sinus is kind of a sinus which looks like a ladder. You have seen the old fashioned ladder has a two horizontal part and the joining two vertical part and the joining in between this horizontal thing. So, this cavernous sinus is a sinus which is having a blood vessel or veins. Now, two veins are there and joining these veins we have horizontal channels. So, that looks like a cavernous look. That is why this sinus present in this region we call them as cavernous sinus. This cavernous sinus joins anteriorly with these veins of the face and with the rest part of the veins in the brain. So, basically the cavernous sinus is a communication from the deep veins of the face and this ophthalmic region to the regions of the brain region. So, this cavernous sinus often gets infected from the infection from the face and the mouth region. So, that particular region, that particular cavernous sinus over here is present alongside of this particular body of the sphenoid, along by the side of the carotid sulcus or carotid artery. By the side of these arteries, carotid arteries, we see a number of the cranial nerves which is related to the SOF. We remember the nerves which is exiting through the SOF. So, they are going to supply the eye, right. So that particular number of the nerves which is related to the SOF, they are traveling through this particular region or traveling through the sinus. So as a result of that, if you have an infection coming from the face, getting to the brain through this sinus, infects this cavernous sinus, the nearby nerves which are present, which are going through the SOF, they will be affected and resulting in affecting the movement of the eye, because they are supplying the eyes, muscles of the eyes, movements of the eyes. So they are supplying the extraocular movements of the eye. That means you are moving the eye to the right side, left side, up and down with the muscles which are making this eyeball movement. The eyeball movement muscles are supplied by this particular trigeminal nerve, trochlear nerve, that particular nerve we mentioned, or abducent nerve, right. So these particular nerves runs along this particular thing and goes through the SOF. So where is the SOF? Here is the SOF, superior orbital fissure. So where is the SOF? It is lying in here by the sides of this particular region. What lies in here is the cavernous sinus along with the carotid arteries. So closed door over here, this particular narrow region by the sides of this particular body of the sphenoid, we have two important structures. One is the structures that is getting through this SOF, and we have the cavernous sinus. Now this particular point is very tricky, is because one is for the infections from the face can directly get in through the sinus, because the veins of the face don't have valves, they can flow towards any direction. So they can go to the face down to the neck, or they can move back. So infection from the face can climb up to the brain directly without any sign. And once this infection reaches to this particular narrow channels, these are ladders as I am saying, and they are communicated right and left. So they can pass through and spread to the rest part of the brain through the venous networks, and can spread to the brain and create an inflammations of the brain, encephalitis, infections of the brain or brain tissues, meningitis, infections of the covering of the brain. So that's how this particular sinus can travel this particular thing to the brain infections, as well as they can stop the blood flow from the sinus. That means the blood which is flowing through the sinus can be stopped, can lead to clotting of the blood, and we call them as thrombosis. So that particular blood is clot within this particular sinus, we call them as cavernous sinus thrombosis. So that particular lumen of this particular cavernous sinus, the blood which was flowing through, now it's frozen, clotted. Now it is become rigid structures. Now that's only problem we have? No, that's not the only problem that we have. Next to this particular cavernous sinus, we have this all the SOF wares that is going in. So the nerves which are next to lying to it will be pressed by the clots, and they will be irritated and they cannot function properly. And so the venous drainage of this particular ophthalmic region will be hampered, and that can lead to a devastations. Only simple infections of the face, neglected, not treated well, can lead to a life-threatening conditions. Apparently, it looks like a small boil, a small ant bite, and an elephant dies. So something like that. So only a single soft tissue infections, or which you can call them a small boil, looks like a tiny thing, can kill that elephant. Only a tiny piece of tumor over this particular region can kill that. Everything disrupted. That's why we have this particular pituitary tumor is so deadly. How big this tumor can be? Mustard seed. Shore se? Sarisa? Dekha hai? That much big tumor. How big is that? Can kill an elephant. Can you kill a human being? So this much thing, a tiny fractional error, is do not have to have this big tumor. A mustard seed size tumor can kill a human being. That cavernous sinus. That compresses and collapses everything. Right? So this particular point over here related to this particular bone, we call them as the sphenoid bone body, deadly part. All clinically relevant. This part I am explaining may not be going through your heads, because you do not understand all the clinical magnitude right now, because you haven't seen any patients. So you cannot foresee these things. What I am able to see, because we have been fortunate enough to see so many cases in our life, going through so many cases in our life, clinical life, and as well as this particular study life as we are doing here. So we have seen this particular thing, how bad these things can go and how quickly it can turn into a situation which is out of our hand. We just like, no matter how we give this particular intravenous injections, after making a call, after making a diagnosis where this cavernous sinus vein is already been thrombosed, it's always too late. The chances are very, very bleak. If you have a cavernous sinus thrombosis and you diagnose it late and then you just like start treating it, it's already just like it's over by the time. So early sign picking up, or before the things starts picking up even, that's the wisest thing to deal with. Unless until you do not know these things, what is called in this medical saying, what mind doesn't know, eyes cannot see. So if your mind doesn't know this particular simple facial infection, eye infection can lead to a death-like situation, you cannot just like see this whole picture of it. So this cavernous sinus thrombosis will come into it. The cavernous sinus thrombosis, the signs and everything will be covered in medicines as well. No matter how many times you read this particular science theoretically, unless until you see these things and experience this particular thing, how these things happens, it's not going to register to your brain. So you know these things at least theoretically, these things exist and this is related to this particular body of the sphenoid, and then you forget about everything, wings and everything, but remember the sides of the body of the sphenoid is the important thing. We call them as the location where this particular cavernous sinus is placed and this particular SOF content are running through, along with this carotid artery. Which carotid artery? Internal carotid artery. The internal carotid artery pops up through here, makes a seat over here, then it makes a siphon or makes a reverse like this, siphons out and then go to the brain. So if you have this cavernous sinus infection, it can catch up to this carotid blood vessels blockage. It can shut this particular cerebral blood flow. How can it catch this cerebral blood flow shut? In physiology, you can learn that particular thing as well. And this cavernous sinus thrombosis related to the blood flow. How can this particular blood can infect rest of this blood in the brain and create a brain infection and meningeal infection? That also is important for us. So this is the clinical relations of this sphenoid bone apart from these basic parts for us. Body, upper part of the body, we have the Sella Turcica. Sides of this, we have the carotid sulcus or carotid artery lodgement point where we have this particular content of this cavernous sinus. Along with that, we have this SOF content running through this, passing through this particular region, and then we have this optic chiasm on top of it, the Sella Turcica. Anything tumor on this particular Sella Turcica related to the parotid, related to this particular pituitary gland can compress this optic nerve if it is a good one, and if it is like very nasty one, it can just like destroy everything together, which is known as craniopharyngioma, which is a very rare kind of neurocraniopharyngioma or neural tissues which is invading. So parotid pituitary gland have got two parts, right, which is anterior part and posterior part. Anterior part again having two parts, central and the middle part. Posterior is neural part, anterior is endocrine part. So your source of this pituitary gland is also from two different sources. So, but anyways, so that particular thing matters to us. And the pterygoid plate and these foramens, of course, they are the important, the SOF and the content of it. So no matter how many times you just like revise this, it's gonna fall short. So do revise the content of the foramens and these particular, what are the structures, neural and non-neural, passing through them, memorize them. You're gonna forget this and again reread this and rememorize these things. So this is all about the cranial bones. We are not going to come back for the cranial bones anymore. This is all over before the university and this third prof examinations about this cranial bones. No more classes will be there. So check it out.